those of you who haven't met me before, my name is Dr. Martine Rukengwa, and I am a UK trained doctor and a woman's specialist. Today's topic will cover mental health. Yes, mental health. Mental health, especially maternal mental health. Maternal mental health, meaning we're going to be talking about mental health for women who are pregnant and women who have just had their children or their babies within the first year. So stay tuned, stay focused, because there will be very, very valuable information. For those of you who have watched me before, I really like to start with the basics because it's very, very important to understand the basics and to understand the facts. Here in Health Corner, we like to bring you up-to-date information based on evidence and also tested information that we know has been approved, has been researched, and this is what we bring to you. Mental health is rising, guys, it is. If I tell you today that 61% of adults in the United Kingdom with a mental health condition don't actually access treatment. If I tell you that 1 in 6 people in the United Kingdom has at some point in time experienced some symptoms of mental health, maybe did not recognize it or maybe did not seek help. These are very important figures. It just shows that it is actually commoner than we think. Mental health problems are more common than we think. And the reason why sometimes it seems like it's not, it's because people do not seek help. People do not go out there to find out what can be done. People do not actually mention it. They suffer in silence. And I really hope that after this, you will not suffer in silence. Let's jump straight into the specific features of maternal mental health. Let's look at the facts about the maternal mental health. Recently, there was a report published. We call it Embrace. So those of us who are in the area of women's health or in obstetrics and gynecology will know what I'm talking about. It is a report that is published at different times to just give us, help us keep track of what's happening with, women who are dying during pregnancy or after birth, and what are the factors that may have contributed to this. My heart was broken when I looked at the report, and there were a few things that were listed in terms of what were the potential or the contributing causes in the death of these women. And some of the major causes, I'm going to list 3 of these major causes. One of them included mental health. So, blood clot in the lungs or a blood clot related problem was one of the causes. And also COVID-19 complications was also one of the causes. And the third one was suicide. Suicide linking to mental health. And that, again, emphasized the importance of talking about this issue. That yes, it is rising in the general population, including among pregnant women or those who just had their children. So it's very important for us to understand that it is a big problem because it is one of the contributors of maternal death, according to the latest Embrace report. And the report went further to talk about how the Black women are still the ones at highest risk in terms of dying during either birth or during pregnancy or shortly after they've had their babies. So it is an important problem. It is something that we need to address. It's something that we need to talk about. It's something that we need to mention. And that was actually one of the reasons that I felt that we should talk about it, because it's quite important. Now let's jump into the facts, because you know I love facts. 1 in 5 women develop mental illness during pregnancy or in the first year after pregnancy. That is a big number. Now, whether this woman would mention it or not is a different matter, but this is what has been projected so far. Another fact I'm going to bring to you is that mental health, especially in the area of mental health, so suicide is the 3rd leading cause of maternal death in the United Kingdom within a year after childbirth. So not only these women need support during the pregnancy, after the pregnancy, but that first year after they've had the pregnancy, it's still quite an important time, because they are still at risk of dying from suicide. I just want to pause, because I think it's important for us to just reflect about some of these things that I've said. We know mental health is important. We know now that it's also becoming a big problem in the pregnancy population and the perinatal or the early mummies population. Then why does it seem like not many people are talking about it? Well, it's very simple. There is a lot of stigma attached to mental health. There is a lot of shame attached to mental health. Nobody wants to say, I've been having very strange thoughts. Nobody wants to say, I've been feeling like killing myself. Nobody wants to say, I feel so overwhelmed and I feel like I want to harm my baby. Nobody wants to say, sometimes I hear voices in my head. Nobody wants to say, I feel so depressed that I can't sleep, I can't think, I can't eat. No one wants to talk about it, because they're worried of how they're going to be perceived. They're worried about how they may be stigmatized in the community. And because nobody mentions it until it has gone so far, we, the healthcare professionals, sometimes do not even know that patients are going through these things, and therefore we are unable to refer them to the appropriate pathway where they will need treatment. So please, after this section, I'm going to talk about some of the things that may start ringing bells in your head, thinking, I need to seek help about this. I need to ask someone about this. Maybe this isn't right. Maybe this isn't normal. Maybe it shouldn't be like that. Please do not suffer in silence. Because once it goes too far, it may be too late to do anything about it. So, stigma. Therefore, we do not know, the professionals do not know about it, so they can't really refer patients or people where they can get the help that they need. Again, poor funding. A lot of the mental health services do not have enough funding. Therefore, sometimes it's very difficult to provide adequate support for these patients who may need to be seen. And because there aren't so many services out there, the waiting time can be long. And we know that in a lot of health conditions, time is an important factor. And the other thing is that we forget about the partners of these women who are struggling with mental health. We sometimes focus on the patient, and in forgetting the partner, they also now end up developing mental health challenges because of the pressure they are under, and we sometimes overlook it and we don't see it. So whether it is you who are experiencing some aspect of mental health challenges, or whether it is your partner who is experiencing some form of mental health challenges, you both need to speak up and you both need to seek help. I've said a lot of things. I just want to recap before I move on to the next section of this talk. Mental health is growing. Mental health is impacting lives. Mental health is affecting pregnant women and after they've had their children, a year after birth. Mental health is the third leading cause of maternal mortality in the United Kingdom. By mental health, I mean specifically suicide. Many people have mental health, but they do not recognize it or they do not seek help for it. And as a result, many people remain untreated. Mental health patients or people who have some mental health challenges are stigmatized within communities, and sometimes even within churches, within religious groups, or even within local communities, because sometimes people have poor understanding of mental health. They don't always know how to relate to people who have mental health, and then they end up moving them aside or end up withdrawing and things like that. So again, there is really that big need of education at all levels. Patients, communities, professionals, churches, various aspects of various members of the society, because mental health is important and it is growing in the world in general and also within our communities. I now want to move on to talk about how do you know whether you are beginning to develop, maybe whatever is happening, something's happening to your mind. Mental health, or people who may develop mental health, may not always have anything wrong with their body. They may not have a temperature, sometimes they may, but sometimes they don't, depending on what's causing the problem. They may not have anything wrong with their organs, sometimes they may, sometimes they may not. So because of that, people may feel generally well within their body, but struggling with a lot of things in their mind, and may not always recognize what are those times where you need to seek help. So please pay attention. A lot of the things that I'm going to say now are very important in terms of time when to seek the help. If you feel low, you feel like giving up, you feel like you do not have any interest in the things that you used to enjoy, and it's a feeling that is there most of the time for several weeks, at least 2 weeks or more, you are a lot of the time in a low mood, demotivated, you do not feel like doing the things that you enjoy doing, and it's a feeling that is there all the time, or at least most of the time, and for several weeks, at least 2 weeks, then please seek medical help. That's first thing. Second thing, if you, again, because of several thoughts, worries or concerns, you're finding yourself losing sleep or sleeping more, increased appetite or decreased appetite over all these thoughts that are battling your mind, or that state of worry and concern, or that state of lack of motivation that has been going on for several weeks, then pause and think. Maybe you need help. Maybe you need help. If you have unpleasant thoughts that keep coming back and you can't control it, maybe you're washing your baby, you have all this sudden thought, what if I drop in the water or drop him in the water? What's going to happen? What if I just end it all because it's too much? I can't live like this. And we all know that, when you just had a baby, the first few months can be quite difficult, quite tiring, quite stressful, quite demanding. And sometimes you feel low about it. It happens to a lot of pregnant women or women who just had babies, and that is normal. But when it keeps going on and on and on for 2 weeks at least, not settling, it's still there. That worry, that feeling of low mood, that feeling of sadness, that feeling that you can't take it anymore, that thought that keeps coming and you can't control it. You don't want to think like that, but the thoughts keep coming and coming and coming. Please pause. Tell someone. If you can't speak to your family, tell the health visitor, tell the midwife, because there is help available for you. If you find yourself repeating actions to feel good, excessive washing, excessive checking, excessive counting to feel better for weeks, and it's something that you can't control, you just have to keep cleaning it, you have to keep washing it, you have to keep counting repetitively, pause, ask questions to your doctor, speak to someone. Speak to someone. If you find yourself that you're so afraid of being pregnant because you're worried you're going to die, or you're so afraid of giving birth because you're worried you're going to die, you're worried you can't go through it, it's a normal feeling. But if it is persistent, if it is taking over your mind, taking over your thoughts, taking over your emotions, beginning to affect how you relate to your environment, how you relate to your pregnancy, please do not keep quiet. Speak up. Speak up. Because help is available for you. It's okay to think that you cannot cope. Help is available to you. And if you've noticed these things and you can't talk to your partner, you can't talk to your friends, you can't talk to your family, you can't mention to anyone, there are numbers, there are organizations, there are people you do not know and who do not know you that you can speak to about this, and they can give you support. If you are at the age of giving up, at the age of ending your life, at the age of giving up everything because it's too much, you can't take it, you can't manage, everything is just overtaking your mind. It could be because of stress, it could be because of work, it could be because of pregnancy, it could be because you just had a baby. Speak to someone. We're going to put a slide on with the different organization within the NHS that you can speak to if you are a woman who is pregnant, if you are a woman who's just had a baby, or a mother who is feeling who is in that mindset, who is going through some of these things that I've mentioned or more. There are numbers, there are links that you can connect to and they will be able to support you. If you don't want to talk to any member of your family, if you don't want to talk to any friend or relative, you don't want to talk to your own doctor, that's fine, because everybody has got a different way they want to deal or manage whatever challenge it is. What is important to us is that you get the help you need. It doesn't matter if you can't get that help from your family or your relative, but you can get the help the right way and from the right organization or the people that have been trained to support you. So please, when that slide comes up, you take numbers, copy the website, copy the links, so that you are able to access the help that you need, the help that you require. This is very, very important. I know that a lot of people, when they hear mental health, they think, no, just pray. You're going to be on too many medication, you can't be cured, you can't be treated. Listen, get assessed first. And the earlier you get assessed, the better it is, so that before the disease progresses further than you want. Not all treatment of mental health must have medications. There are treatments that do not require medication. There are therapies that can be given to you. There are support groups that can be offered to you. There are different type of treatments that can be offered that may not necessarily need a tablet, even though sometimes tablets may be offered, but it's not the only option that is available. So do not let your fear of what the treatment would entail stop you from seeking help. Mental health is important, and it's leading some people to commit suicide. And there's something that we can do, as little as it can be, to try and help ourselves and help our loved ones. This series has 2 parts to it. I'm doing this first part, but there will be a second part where I will be there, but there will also be a Christian trained therapist, and together we'll have a live session. So the second part of this talk will be a live session where we can be more interactive in terms of questions you may have, queries that you may ask, and also, suggestions you may have, so that we can talk about it, discuss it, and not run away from it, because it is an important topic. Share with friends, colleagues, everybody, and let them know that there is a part 2 coming, and we will tell you date and time when that will be happening, and we'll hope that you'll be able to join us. Maternal mental health is important. It can be picked up early, it can be treated, and as an organization, as part of our mission, we're bringing that information to you in the Health Corner. Until next time, stay blessed.